As the nation's hospitals and health systems continue to battle the ongoing public health emergency, now, more than ever, we must harness the collective power of our communities to champion changes that will advance health for every individual. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, Executive Speechwriter for AHA. The Foster McGaw Prize recognizes hospitals and health systems that are leading the way through innovative collaborations that improve the health and well-being of everyone in their communities. While we were not able to present the prize last year due to the pandemic, the AHA is honored to bring you this podcast series to share the stories of our most recent recipients. Our moderator is Janet Porter, a member of the Foster McGaw Prize Committee. Today she'll guide a discussion on how Foster McGaw finalist UMass Memorial Medical Center prioritized going upstream outside the hospital walls to address the root causes of impacting health outcomes.
Thank you so much, Tom. Hello, everyone. I'm Janet Porter, and I'm a health policy professor and longtime proud member of the Foster McGaw Prize Committee. I am so pleased today to introduce you to Monica E. Lowell, who's Vice President of Community Health Transformation and Community Benefits at UMass Memorial Medical Center in Worcester, Massachusetts. And we're going to be discussing the Foster McGaw Prize finalist application and the programs that they've developed to meet the needs of the communities they serve. So thank you for joining me today. And let's get started. So, Monica, first of all, congratulations on being a finalist for the Foster McGaw Prize. This is the second time you've been a finalist, and we have so many applicants that it's really an honor to be seen as one of the top 4 systems in the nation in terms of promoting community health. Let's start by you providing an overview of UMass Memorial Medical Center in terms of scale and breadth, and also some characteristics of the central Massachusetts region.
Well, thank you very much, Janet. Well, UMass Memorial Medical Center is part of the healthcare system, UMass Memorial Healthcare. We're located in Central Mass, and we are the academic partner of UMass Medical School. We have a 4-campus academic institution. We are the largest not-for-profit healthcare system in Central Mass with 14,000 employees and about 1,700 physicians. And we are located in Worcester, Massachusetts, the second largest city in New England.
So one of the things I remember from your application that I just want to comment on, so we talk a little bit about the demographics, is that you have 113 languages spoken in your service area. I could not believe that. And also that your population of Hispanics is about 20%. So give such a brief description of the demographics of the area you serve.
Yes, well, Worcester is refugee resettlement location, and actually we've seen large diversification in the last 10 years, and it is still largely Latino, and we have Black African American, but in the last 10 years we've seen a huge influx, and part of it is because of the resettlement refugee status of people from Africa, Nepal, Bhutan. We also have a Vietnamese community. And so it's very rich in its diversity. And of course, that's also reflected in the Worcester public school system. And having an impact also with the languages in our healthcare system, where we have a very robust medical interpreter program for quite a while now. Like 15, 20 years.
Yes, you must have a very robust program if you're meeting the needs of patients speaking 113 languages. My gosh. Many of the people listening today, you developed a community health needs assessment, and your top priorities were identified as mental health, substance abuse, chronic and complex conditions, and then meeting the social determinants of health with an overview of health equity across all of those dimensions. So let's start with your priority of mental health. So, Monica, most of our hospitals across the country are struggling with how to wrap their hands around this issue, especially as COVID has isolated people. So UMass Memorial has had many different initiatives to improve mental health. So please talk about some of those. And in particular, I want to make sure you mention your youth mental health model that you developed way back in 2003.
Yes, indeed. Actually, we have been focusing on the mental health primarily in youth. And the youth mental health model was pretty unique. Actually, it came as a result of needs assessment where about 400 plus youth participated and indicated that they needed a different kind of model where they could go to a youth serving organization, not go to a specific clinic, and rather be able to feel comfortable and meet staff that would be able to help. And so that program was developed, and we work with youth organizations in having counselors that are part of the staff. And so when youth are coming at these after-school programs, they can identify the needs of some of these youth and have an intervention. Yearly, there's about over 700 contacts with the youth, but it really plays a critical role in terms of crisis intervention and prevention model for youth, and most of them are actually youth of color, primarily Latino and Blacks.
We were so impressed that you talked way back in 2003 about really co-designing this program with youth in your community. So that is very impressive. You also have a great program called Worcester Addresses Childhood Trauma. You call it the Worcester Acts program. That focuses on children who have experienced or witnessed adverse childhood experiences. So could you talk a little bit about that program?
Absolutely. That program actually came as a result of a need that was identified by the Worcester Youth Violence Prevention Coalition, where they saw that there was a need to address. And so we worked closely with coalitions and decided that we needed to work collaboratively. So you have a very diverse group of stakeholders, including the domestic violence from the YWCA, Clark University, child protection programs, and we utilize community health workers. When there is a trauma event, the community health workers are immediately deployed and go into the homes and work with the parents. The whole purpose at that point of entry is to contain the family, make sure that services don't fall through, and then consistently work them through the process as they're getting the intervention. So the community health workers is like a glue that holds services to maintain the child and the family together.
Terrific. So UMass Memorial has also been very focused on improving the lives and health status of inner city youth. Again, you have many programs, but please share with the audience how the Building Brighter Futures with Youth and the HOPE programs have worked.
Well, we value youth. They're our future, and we see that jobs are critical. Again, we always, when we do our community health needs assessment, youth have a great voice. Jobs have been a critical part of really addressing poverty. Many of these youth actually are the ones that are contributing money to their household. So we have partnered with the anti-poverty organization. We also have jobs in our system, and we are able to, through this providing jobs and this relationship with the Community Action Council over the last 10 years, we are able to leverage state funds to also bring more funding so that youth can be employed throughout the city. So here's an opportunity where the hospital plays a role, not just in providing jobs, but leveraging funds. And then the other piece is the HOPE Coalition. We also fund a coalition of youth. They have a voice. They work closely with one of our staff. She actually happens to be a professor at Clark University. And the youth learn public research methods. They look at some of the needs that are impacting the community, and then they learn about how to collect the data, how to analyze it, and then if there needs to be a recommendation for a policy change, they've done that. For example, they were able to pull tobacco products out of the pharmacy way before anybody else in the area. youth have a lot of knowledge, and it makes a lot of sense that we have this group of core peer leaders that look at a public health problem and work in addressing it to improve the health of the community.
Thank you for describing that. You know, Monica, University of Massachusetts has also worked with economically challenged neighborhoods in your area like Bell Hill, and you have a commitment there that's over a decade old. Please share with the audience today what has been most successful in improving the community and health outcomes in Bell Hill.
Yes, Bell Hill is in one of our campus's backyard, so we are very committed to work with the neighborhood. One of the things that came out was that there was no supermarket. We had great food insecurity. We had food desert, and the neighborhood asked if we could do something to help with that. So as a result of that, we actually, there's really not a whole lot of land, but there was a park that was semi-abandoned that was on the list actually to maybe get rehab. And so working with the city of Worcester, we were able to secure the land to get urban agricultural program where youth from the neighborhood actually learn about organic farming, and then they also, the produce that comes out of this with the neighbors is also given to a Veggie-mobile that goes around the city providing produce to other neighborhoods that are food insecure. So we are kind of addressing two problems there, is the food insecurity and, again, jobs for youth of color in the neighborhood. The other piece is that we worked with public housing unit at Plumley Village, and again, also they needed no access to a supermarket. We were able to work with our national headquarters, and within that housing complex, we work collaboratively in getting a community garden established there. And food insecurity, as you know, it's just, even with COVID, it has been magnified. So we are very happy that we were able to do that. And then I'm very proud about what came out of the Belmont Street School in Bell Hill, where one of the principals asked me if I could help her because some of the asthmatic children had huge absenteeism. And so we worked on developing a model, an evidence-based model. We looked at some of these absenteeisms, and we recognized that there was a problem. And as a result of that, we actually developed a citywide intervention that addressed pediatric asthma, multi-sectoral partnership that has the community health centers, the schools, community legal aid, the cities, healthy homes, all working on addressing pediatric asthma. And through this effort, we saw a reduction in some of ED visits over a year, also a reduction in rescue medication refills and some of the oral steroids use. So it got spearheaded, incubated in Bell Hill, and we then implemented a community health worker across with the partnership.
Monica, you're being modest. I want to augment what you have just said about the pediatric asthma program. So your application talked about how you have reduced emergency visits of asthmatic children in half, but more importantly, you reduced hospitalizations by 86%. And we've seen in our work nationwide on Foster McGaw other pediatric asthma programs, but I can't remember seeing one that had this outcome. So you should be very proud of that work.
Thank you. That was within the cohorts of the groups that we were working with.
Very impressive. But I want to go back, Monica, to this notion that in 2018, University of Massachusetts adopted what they called an anchor mission that has three components: local procurement, workforce development, and investment. Would you talk about that for a minute?
Well, the anchor mission, I get very excited about the anchor mission because really this is a strategy that really will address some of the poverty issues that we have in society as a whole. Social determinants of health. If we don't work on that and we are conscious of how those issues are impacting healthcare, we will not really be able to move the needle. So being able to focus on giving opportunities to hire within our own backyard, that will allow people to be employed, have insurance, be healthier, eliminate the poverty level, developing a pipeline that we can have people move into our system, investing in vendors in our own backyard. Why not invest and increase the economic power, give the opportunity in our own backyard rather than investing, 1,000 miles away from where we are located. And then lastly, investing in housing, investing in maybe businesses. So we have done over the last year and a half, we actually took 1% of our investment dollars in that system. Board of Trustees was very excited about that. And actually, we have different committees working on all of these sectors. In fact, there's also a volunteer group that is also organized and working on how our employees, imagine we have 14,000 employees. How can we also be volunteering and having more of an impact in the community? We've been addressing with the investment, worked on investing in neighborhood revitalization and also some community development corporation work on homelessness for seniors, being a one tour for a homeless project. So we've actually done quite a bit in the last year and a half.
That's very impressive. The value of local procurement, not only is it stimulates the economy, but you also end up oftentimes diversifying your supply chain. I worked with a hospital recently, Monica, that was pushed to do a supply chain analysis to identify the percent of their procurement that was to minority-owned businesses, and the answer was that it was 0.5% of their spend. It was a real wake-up call, and one of the things that they decided was that they could solve that just by going local. So going local has many benefits, not just economic development, but also diversifying the supply chain so that it's not just the same old providers. So great ideas.
You're right on, Janet. Looking at those policies, too, and what else can we do to support and enhance that? Maybe it's also training for those businesses.
So, Monica, I want to close by saying that we're having this conversation, and you actually were an applicant while we had COVID going on, right? So COVID-19 has affected almost every aspect of our daily lives. So how has the work at UMass been transformed, where you still support all this community-based work but do it amidst a global pandemic?
Well, I'm just so excited about what we've done with COVID. A year ago, actually, I deployed our Care Mobile program to work on the pandemic, and we developed an outreach program that went out into the neighborhoods and offered education on proper masking, masks, hand sanitizing, COVID prevention. And then our CEO, there was an opportunity. The governor asked if we would do a Stop the Spread free COVID testing, and working with the Worcester Division of Public Health and neighborhood partners, we did community testing throughout the neighborhoods during the winter months. We tracked the data. We saw where those needs were. We organized a committee of diverse stakeholders. Every 2 weeks, we reported on what the trends were, where we're being located in terms of testing. And in the winter months, we actually partner also with a business enterprise that offer us an incredible location to centralize and offer the testing downtown. And so this has really been a community effort. We have a health equity committee that has been looking at the testing, swift operation. We're testing about 350 people in an hour, 1,500 people in 4.5 hours. It was like the United Nations, people coming to get the free testing. We have also pivoted to do vaccines. Again, kind of the same thought. we are going to the locations, partnering with the faith base, partnering with the Boys and Girls Club, partnering with the community development corporations to go and offer that testing there on site. Priests from the pulpit are educating, so try to address obviously Latinos and Blacks who are those most at risk. In the neighborhood, we also do homebounds. People that have been identified cannot get, say, to that church or that community-based organization. So it's just been really rewarding because the community has partnered with us and helped us not just in educating, but also helping us with the whole process of making it a successful vaccination program.
That was a great description of the breadth of efforts you've made during COVID. We are so pleased to recognize and extend our congratulations to you for being a finalist for the Foster McGaw Prize.
Thank you so much for the opportunity, and maybe our paths will cross again.
Thank you very much for joining us today.